InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our honored guest, is Dr. David Preskill. Welcome, Doctor.
Nice to meet you, Mr. Stone.
The doctor is a longtime resident of Chicago's North Shore. He graduated from Northwestern University Medical School and trained in obstetrics and gynecology at Northwestern's affiliated program. Currently, the doctor's hospital affiliations are with Northwestern, Lake Forest, and Advocate Condo. Now, you grew up in the North Shore before you went to Northwestern and became a doctor here.
Yeah.
So, how did you get interested in becoming an OB/GYN physician?
Well, that's a funny thing. I always, wanted to be a physician from a very young age. Probably age 5 or 6, I wanted to become a doctor. And then you end up in med school, and you kind of don't know what kind of physician you're going to be. And I'm a person that is well coordinated. I was a kid that used to tinker around in the basement, fixing things and putting things together, taking them apart. And I realized that there's two kinds of medicine. There's cognitive medicine, that would be like an internal medicine doctor or family physician. And there are more surgical specialists. And interacting, so I made that shift, and I realized that I felt like I communicated well with women. And it was easy for me, and they responded positively to the communication. And OB/GYN is kind of a cool field because you take care of healthy people, and you bring them, in obstetrics, you bring them from a normal but different state into the delivery room and deliver their child, and it's usually very positive and happy.
Good.
So that's how I ended up.
Okay. Now, you've practiced OB/GYN medicine for over 25 years.
Yeah.
Can you say a few words about delivering babies you've delivered?
Yeah, that's interesting. So sometimes inappropriately, some of these people I've delivered 20 years ago are that child I delivered, maybe they're a little young, but they are pregnant. And all of a sudden you see the woman that you delivered, her daughter is in labor.
Does that make you feel old?
It does make you feel old, yeah. You'd be lying if you said otherwise.
Do you have an idea of how many babies you've delivered?
Probably somewhere around 6,000.
6,000?
Something like that.
Yeah, if that did one a day, that would be what?
I don't want to think about it.
20 years.
Yeah, there are a lot of tired, sleepy days and wakeful nights.
And has OB/GYN medicine changed from when you started 25 years ago?
Well, at core, it's kind of the same. I mean, the science is somewhat different, but it gets rehashed. One idea that falls out of favor becomes in favor and then rotates back around again. So I am very cautious when I see a change, and I wonder if a change is valuable. Am I going to hurt anybody with this change in practice? And at the same time, there are certain needs and concerns that happen after childbirth, as an example. And for some things, we don't have a good solution. And sometimes we create new solutions that we learn about. And the question is, how do you implement a new solution? Is it safe? Is it effective? You don't want to do any harm, but you do want to help people that are having issues.
Okay. And what do you find are the most asked OB/GYN questions?
The asked OB/GYN questions. Well, around obstetrics, they have concerns about the safety of their child and the security they feel with delivery. After having a child, women look at themselves They feel differently about who they are at some level. They wonder if it's normal, the changes that they've seen in their own bodies. They want to feel the proper connection with their spouse, and they wonder how their spouse is going to relate to them.
Now, do you ever get involved with postpartum depression?
We have that happen because it happens to our patients, and we screen for it very cautiously. Yeah.
And what are some of the screening processes? Is it questions or observation, or just what the patients are telling you?
Well, you have to ask questions honestly if you want a response. So I ask people how they feel. I look at them in the eye and I say, "Are you comfortable? There's a screening test which has, I think it's 13 questions on it, and certain questions are truly red flags, but it's mostly being a good observer."
And this screening test, is it people or the women, they just answer it at a computer or?
No, they answer in front of you.
Okay.
We give them a clipboard, and they check. It's basically a multiple choice questionnaire, and if one or two of these questions is answered yes, then all bets are off. We have to watch that person very closely.
Okay, and besides your OB/GYN medical practice, is there anything else you are doing to support female issues in women's health?
Yeah. Well, one of the exciting things that's come out more recently is a new laser for the inside of a woman, for her vagina. And we were approached a little more than a year ago to investigate this device.
Is it for clinical trials or?
It is being a clinical trial is being done at the Cleveland Clinic currently, right now. But it's a device. It's a laser vaginal treatment developed out of Israel, and over the last 4 years, it's been used extensively in Europe, where things are looser, medically speaking, and South America, with very good results. And it has two purposes. It helps stabilize the bladder of a woman after childbearing. And a lot of women have problems with the physical things that occur to a person, like coughing, jumping, working out, all those things.
Lifting?
Laughing, lifting. They leak small amounts of urine. And it's enough to be very annoying for them. Happens to about 30% of women after they have a child, at least 30%.
And does the risk increase with multiple births?
Yeah, but one delivery can make all the difference. It's just today, using this device, I saw somebody who had one cesarean section that presumably didn't create any problem, but afterwards she had one normal delivery, and she inquired about the procedure. It's called the Fem Lift procedure, and it stabilizes the bladder by building collagen at the urethral neck, and when a woman coughs, her bladder can move downwards, but the urethra is stable, and it creates like a natural kink. So the laser builds collagen around the urethra, but then it does a second thing. And the second thing it does is it firms the entire vagina and creates it a little smaller vagina. And so the company really promotes it as a sexual enhancement, which it does do, but I think in the Midwest here we are a little more practical. It was introduced in New York, Miami Beach, and Beverly Hills as this sort of pseudo-cosmetic procedure, but I've really viewed it as a practical concern and benefit, and the secondary benefit.
So how long have you been performing this procedure at your clinic?
We're approaching a year now.
And so when you go back and follow up with the patients, what kind of feedback do they give you?
Well, as I was saying, patients come in for the leakage issue, and usually after the first or second treatment, they noticed a marked improvement.
So would they be going to women be going to the bathroom less each day?
Well, it's not about going to the bathroom less, they're dry. Yeah. We have one woman that had a major surgical procedure to control her bladder 4 or 5 years back that worked for a few years, and then she came to me. She heard about the procedure, and she's a marathon runner, and she was unable to run without leaking urine. And now she's able to run and she doesn't leak urine at all. So that's one part of the feedback. And then the second part of the feedback is this sort of this kind of quieter discussion that women have, saying that when they have intercourse, they feel more connected to their spouse, and they have a heightened experience. So that's been a very big surprise. To be open with you, the devices work better than I thought it might. We ended up creating a group of doctors, all gynecologists, because we feel that we really understand the dynamics, both emotionally and physically, the changes that occur before and after delivery, and just with age in general around a woman. And a group of us have adopted this laser. We have multiple offices throughout Chicago. The company's called Femina, and it's been a very exciting time for us, really.
Now, is this a procedure that's going to be covered by insurance?
So
I'm sure your patients are probably...
They ask that question every time.
Yeah.
We've had a few patients apply to insurance and get some of the procedure covered, but the origins of the procedure are from this cosmetic surgical company, and they don't have interest in creating, I think it's called the CPT code, around their device. And I think it's going to stay as this sort of elective procedure, which is sort of too bad. But it's not a fortune to have performed. People pay more for things they like to do in our world than this procedure costs.
Now, when you explain this procedure to your patients, do you have like diagrams or pictures that you show them?
Yeah, we have tasteful diagrams and pictures, and I draw pictures, and we have a video that we put together. There's a video on our website, and it's interesting. Many patients talk about the leakage or incontinence issue, but then I think if I'm reading them correctly, half the reason they want to have this done is for the intimacy issue. So,
and by the way, what are the ages of your patients?
So my patients are, in my whole practice, range down to probably 14 years old. I saw a young woman today, like you mentioned, the daughter of, I think I delivered her years ago, which was interesting. And she was kind of going through her first moment of having a period and struggling a little bit. And we take care of women all the way up, probably up to 90 years old.
And do you think you could do the Fem Lift with women in their 80s?
So the age range that's advocated by the maker of the product is childbearing. So probably mid-20s to upper 20s would be the youngest we would do, because there are people that have had 3 children by the time they're 26 years old, and they have issues, and up to age 65. And I don't know why they put the limit at age 65, and
it may change.
It may change, and I think it's subject to discussion and examination of the patient.
Okay. And doctor, how were you introduced to Femina and the laser?
So it was a kind of a cute story, I guess. It was brought to me by the maker of the company that happens to be based in, this Israeli company has an outpost for the United States in Buffalo Grove, Illinois. So not that...
Of all places.
Of all places, yeah. Somehow they ended up there. And so they were looking who was an innovative physician, I think, who had a nice practice. And my practice is nearby in Libertyville. I live in Highland Park. And I went to visit with them. And to be honest with you, I'm not sure if the way it was positioned to me was the best way. It took, it was uncomfortable for me at first, because it's presented as this exciting sexual tool. And that's not where I come from.
Yeah.
But I took the data and I analyzed it, And I even vetted it with I have some friends that are specialists in women's incontinence. They're called urogynecologists. So I discussed the procedure, I showed them the studies, and they said, in reality, this makes a lot of sense. Adding collagen and firming the vagina, strengthening the bladder, neck, should work very well. There have been other attempts at putting collagen into the vagina in the periurethral area, it's called, by injection or other methodologies that have succeeded but have never sort of gotten traction. And probably because those other methods were more involved. This is fairly painless on the pain scale.
How long does the procedure take?
So patients come in and the procedure takes 8 minutes, and we typically offer some anesthetic cream that we would place about 20 minutes before, and that helps. But there's a kind of patient that people fall into two camps. There are women that have had all sorts of things done to their aesthetic, their face, and they'll just say, just take care of it. And they claim that the discomfort is less than having a facial procedure done. And there's another kind of patient that is more sensitive, and we try to be good listeners, and we always offer the anesthetic cream.
Are there any dangers of side effects?
Well, I've been looking closely, and I haven't found anything that comes close to a dangerous moment or a concerning moment, and that's made me very comfortable.
Is there bleeding as a result of the?
Very rarely. There's some spotting, more commonly for patients over 60 years old, but very minimal.
Now, you mentioned you add collagen, I believe?
So the laser is a single laser beam. I'll try to describe this. Imagine one laser beam, and this machine takes this one beam and divides it out into a 9x9 grid, so 81 little pixels. Each of those pixels is a part of that laser beam, and the penetration depth of each little laser pinpoint is only 0.3 millimeters. It's very, very shallow. But the laser creates edema or swelling. The swelling in turn, a month later, 2 months later, 3 months later, 4 months later, builds natural collagen from the body's response, and that's what makes the change in the woman's body.
So the woman's body produces the collagen?
Yeah, so there's no medications that are really added in. It's basically changing the blood flow, enhancing blood flow, building collagen. It sounds hokey to call it reversing time, but it really does change an organ that went through childbirth.
Have you ever worked with lasers before this?
Yeah, I have, a little bit. In the past, we did laser hair removal, and many practices did that.
And did you work with lasers when you were in medical school?
Yeah, I guess I did. I didn't think about it, but I've been around lasers really since physics class back in high school.
Okay. And so, do you want to explain any more about the Fem Lift?
Well, just that we're happy with it, and more importantly, the patients are happy. It's been a process of education, because we start with a patient that has never heard of it. She hasn't had a girlfriend that's had it, or hasn't even had any kind of hearsay.
Would you discuss it, with a woman who was pregnant?
Well, usually when they're pregnant, I focus on their pregnancy.
Yeah.
But after they come back for their 6-week postpartum visit, you start to analyze.
You can see if they even need it.
That's correct. You analyze delicately. I try to be a good listener to hear what that patient's concerns are, and not what I'm not the doctor where because I have a hammer, everything's a nail. Try to kind of just pick and choose and select who would be happy with it and who might benefit from it.
Okay. And since Fem Lift is so new, explain what you did to make sure Fem Lift was safe and effective.
Well, it really goes back to being very cautious. At the beginning, we were very, very selective with the patients, having a narrow range of who we would allow.
When you say who, who's part of the who?
Well, there are other physicians in this group of ours, and we would examine the patients first, and
More than one physician examining?
not at a time. No.
Yeah.
We would each have our own, patient. We'd discuss each case, and now we understand how the device works, I think, in a very thorough way. The maker of the product presented it as kind of this is so easy, you could have anybody do it. Dr. Preskill, you don't even have to do the case yourself. You could have your nurse do it. That's not who I am. And really what you learn with these tools is they're just tools, and it's about how you use the tool and how you assess each patient individually, and create like a plan. I examine my patients. I make sure they're safe for it. I have I draw a kind of a mental map of where I'm going to treat the patient internally, and I apply the energy in that location with caution.
Has a patient ever asked for the Fem Lift, but you turn the patient down?
Yes.
And what would the reasons you wouldn't perform it?
So some patients, sadly, will have a primary disease.
Okay.
They might have a neurologic disease that I know the Fem Lift will not help with. There are different kinds of leakage that women have. There's the bulk of women have this grouping of leakage called urinary stress incontinence, and there's a kind of a rarer leakage called detrusor dyssynergia, which is really a sort of a spastic bladder, and you can figure out who's who sometimes by history, and sometimes you might want to send some of these patients to be assessed. There's some measurement tools that urogynecologist would have available to them that.
So you
might refer the patient out.
Okay.
But what we're seeing are people who thought about surgery and the discomfort and pain over traditional surgery, whether it's to surgery to strengthen the urethral neck. In the past, there was bladder mesh you might have heard of. That's the FDA has actually kind of pulled back on its safety. It's a high caution situation.
Did you used to use that?
I didn't. I always felt that might be a bad choice, so I never got involved with that.
Good for you.
You have a gut feeling about some things. And you also could do vaginal tightening by literally trimming portions of the vagina out, which is something that is very painful and would not be part of a common practice.
Would that be a surgical procedure?
It would be surgical. So there are different invasive surgical procedures that might put someone at bed rest or at risk for infection, at risk for bleeding, at risk for new pelvic pain, that are the alternate to this minimally invasive treatment.
Now, let's say a woman goes through the 8-minute Fem Lift procedure.
Yeah.
Is it just a one-time procedure, or is it multiple times?
So we see results after one treatment, but we know the results will last if they get 3 treatments. And so the maker recommends 3 treatments, and if we're almost there, I'll even go ahead and give a 4th treatment. The treatments are about a month apart. It's not very strict if it's 25 days or 35 days or 40 days, but they're about a month apart, and they come in quickly and leave very quickly. They go about their day. People joke about it. They call it a lunchtime procedure. Mm-hmm. But the concept is it doesn't take all day long. It doesn't set you back. You can drive yourself and take yourself home. You don't need a driver or anything like that.
Okay. So please compare your OB/GYN practice to other OB/GYN doctors.
Okay, that's an interesting question. Well, in many ways I'm traditional because I'm cautious, and I believe I'm a caring person, but we try very hard. We have an especially opening and clean environment. That's a big difference. We work slowly. We don't use computers in the sense like I'm not sitting in front of the patient and tapping on my keyboard. I use paper notes. We are not owned by a corporation. I'm not owned by Northwestern or advocate, although I can see their patients, but we are a private practice, and the other doctors are too.
How many doctors are in your practice?
There's 3 of us doing the Fem Lift treatment. In my practice in Libertyville is that alone. It's my own. I have 1 physician assistant that works with me, and it's a super clean, polite, small office.
It's like a family-owned business.
It's really like a family, and our group people get a very warm feeling, nice feeling about being there. So we don't answer to like a corporate body that tells us how quickly we should see patients, that's a very big difference, I'd say, in our world.
Well, and I would think your compassion, your knowledge, your skill, your experience I think you're right in that tip. I mean, doctors are in the tip of the bell curve, and then you're at the tip of the doctor. So you've made a great impression on me. Why did you create the Femina Spa?
Just to create an environment that would signal to the world that we offer this. It's hard to describe something that hasn't been done before. Mm-hmm. And this is certainly a sensitive topic. If you think about it, women don't talk about this, sometimes even amongst friends. Mm-hmm. And so we wanted the name to politely represent what we were about. We're not about back rubs or anything like that. We're about taking care of a woman's private parts, along with our regular practice.
And are there any other services you offer besides the Fem Lift as part of your spa?
So my core business is a traditional practice again, and we do offer 2 other services in combination. We call it areyoudone.org. And I've had so many women sitting on the exam table after they've delivered a baby, maybe their 3rd child, and they'll say, "Dr. Preskill, I'm done." And we know just what it means. They don't want to get pregnant anymore, and they're tired of having a heavy period. And we offer 2 procedures in concert, one to close the fallopian tubes, mm-hmm. and one to minimize the lining thickness of the endometrium, the menstrual lining.
Yes.
And this combination creates essentially a 0 chance of getting pregnant in the future, and a very light, or sometimes, if we're lucky, even an absent menstrual flow, and minimal cramping, because a lot of that cramping pain women feel.
So women just feel overall better health. I'm sorry, we're out of time.
Oh, that was fast.
For more information about Infinity Foundation, InnerQuest Talk Show, or The Good Doctor here, please stay tuned to the credits at the end. Until next time, wish you good health, good spirits, and good fortune. It's a pleasure to meet you.
Thank you.